Hi everyone, welcome to Public Health Insights. And today we are going to discuss a topic that goes well beyond the typical idea of visiting a doctor, that is comprehensive healthcare. So, when we hear the word healthcare, many of us think of hospitals, medicines, treatment, nurses, doctors. But comprehensive healthcare is much broader. It is about taking care of a person in every possible way and not just when they are unwell, but throughout their life. So, in this session, we'll walk through what the concept mean, how it works in real life, why it matters so much in public health, and how it is being implemented in places like India. But you'll see that this approach can transform entire communities. So, talking about what all is going to be present in the presentation, all in all. So, before we get into the details, it is very important to have a roadmap because that will be fitted in your mind, and whenever you are writing an answer, that will actually flash whatever you have read. So, first of all, we'll define what comprehensive healthcare actually means. Then, we'll look at the guiding principles that make it effective. Then, we'll break down the different components that form the backbone of this approach. Then, we'll also connect it to the bigger picture of primary healthcare and universal health coverage because they are closely linked. And after that, I'll share some examples, including how India's Ayushmann Bharat program fits into this model. We'll discuss the real world challenges in making this work and then move on to some practical solutions and innovations that are already making a difference. Finally, we'll wrap up with a call to action and I'll also give you some practice questions that are most probable questions and for the NEET PG examination as well as UGC NET, and then we'll wrap up the topic. Okay, so talking about the topic in detail. So first of all, we'll move to the definition and then we'll move to the principles part. So comprehensive healthcare, it is a system of health services that covers every dimension of a person's well-being. It's not just about curing a disease, it's also about preventing it, promoting healthy lifestyles, protecting people from health risks, and managing long-term conditions in a sustainable way. So, first part first. When you talk about health, which definition does pop in your mind? I think most of us will have that WHO definition of health. So, in the definition, we see that there are many components or many dimensions of health, like physical dimension, mental dimension, emotional, social, spiritual, like that. Okay. So, what are these dimensions? These dimensions are actually very closely related to each other. Like, for example, just imagine you're having chronic back pain. So, will that back pain be only physical? Will it not affect your emotional well-being or mental well-being or societal or social well-being? Of course it will, because when you are having chronic pain, you are having any kind of pain or any kind of problem, then you have this feeling that I need to move alone. I don't want people to gamble around me. You develop a sense of being uh, you know isolated, and you don't want to interact with people so often in such cases. So that is going to affect your physical health, your mental health, emotional health, and also your social health, because you are going to get isolated from people. You won't like people talking much around you at that time. Okay, so it's very important for for a health system to cover all the aspects of a person's well-being. So comprehensive word itself means holistic, and holistic means whole. Okay, so comprehensive healthcare makes sure that all the dimensions of a person's health is actually taken care of, and it's not something that just that is just concerned with curing a disease. It's also about preventing it, promoting healthy lifestyles, protecting people from health risks, and managing long-term conditions in a sustainable way. You need to remember this very deeply. Okay. Then, principles of comprehensive healthcare. It's very important. The first principle is equitable access. So whenever you are studying any topic, then make sure that uh, in case a term arises, you need to cut that term and then understand each word separately, and then you need to relate it to the definition of the topic, and that will, 100% I'm sure that will help you in writing, anything about that topic. So it's very important for you to break the terms and then relate it with the definition, because you already know the definition of the topic. So you will then be able to think beyond what you have already learned. So this is a very good method, and it really works for me, because whenever because initially I was not very good at answer writing, but then after I developed this theory, then I write very good answers now, and I personally believe, in fact, my professors also used to tell me that no, this way of writing answer is good actually, and it really worked for me. So I want you guys to relate similarly. So it's very important for you to break the terms. So talking about the principle, the first principle is equitable access. So equitable will somehow relate to equal, and access will somehow relate to availability. So what will it mean? So health services should be available to everyone regardless of where they live, how much they earn, how they look. Any kind of discrimination won't work in case of health services, in case of accessibility of health services. So you need to know that the first principle is equitable access, and it relates that nobody should be banned from taking health services. So it's very important, you need to remember this. And this, then the second principle, it is continuity of care. So continue somehow relate to continuous, and care, you already know what is care. So a person's care does not stop after one visit. It is a continuous process throughout different stages of life and different health needs. For example, uh, imagine you are sick today, you're having cough today. So is confirm that you are not going to have any other kind of health problem anytime in your life? No. Of course, you can fall sick anytime. So it is a continuous process. It is a lifelong process. Health services are something that you need to have access for a lifelong journey. It's not like you fall sick today, then you are not going to fall sick tomorrow. That's not the scene. So it is a continuity of care. It needs a continuity of care. It is a lifelong process. Okay. Then talking about the third principle, cultural sensitivity. Now breaking the term. Cultural will somehow relate to culture, and sensitivity is an emotional feeling. Okay. So, how will you understand this? For example, you live in a village and there are not very much options. You have two options of healthcare specialist, be it two doctors. The first doctor is very warm, he's very welcoming, he's very positive towards his patient, and he treats patient like his own family. And then there is another doctor, he is equally competent, but then he is not welcoming at all. He's very negative. He's very rude. So, are you going to visit the second doctor? I think no, none of us will prefer going to the second doctor, because health is something that is not maintained just by drugs or treatments and all. It's a feeling that involves the mental and emotional, social aspect, all these aspects too. So it, in case whenever you are sick, if you'll have people around you who speak positivity regarding your treatment or your drug, then it's more likely that you are going to be cured in a better way, and speedily, as compared to you living around negativity. So health is something that is influenced by emotional well-being, social well-being. So it's a very soft thing. Health, whenever you talk about health, it's a very soft and sensitive thing. So health should respect uh, local beliefs, traditions, and languages, so that people feel understood and valued. And then this adds up to a better prognosis, a better recovery. Okay, so the third principle is cultural sensitivity. I think you must be aware about these uh, terms. We have already read it. And then talking about the fourth principle, that is patient centered. Now, what will it relate? Patient, you know what is patient centered means that the patient should be the focal point. Okay, focal point of the treatment. So this means that listening to the patient's needs, preference, involving them in decisions regarding their health, and making them active partners in their own health journey is very important. Like for example, whenever you see that any person is going to get into any surgery, then it is required. The ethics says that the healthcare professional should explain what are the pros and cons of the treatment, and then the patient should have an independent say whether they want to opt for it, or reject it. So it is very important that the treatment should be patient centered. It will add value to the patient, and the patient will feel that I am taking decision for my health myself. So it will add up to the positivity of the patient, so that will speed up the recovery process. So it's very important that the healthcare services should be patient centered. So now come to the components of care. So you can remember the components of care by the mnemonic 5P plus support, and it is very important for you to remember this. So to make comprehensive healthcare easier to people, it is divided into six major components. The first component is promotive component. That means encouraging healthy behaviors like exercises, balanced diet, and avoiding tobacco and alcohol. Then we have the preventive component, things like vaccination, screening test, and health education to stop problems before they start. Then you have the protective component, like measures like clean water supply, safe sanitation, pollution control that guard communities against diseases comes under the protective component. Then you have palliative or curative component, that is providing effective treatment when someone gets sick. This comes under the curative or palliative component. Then we have post care rehabilitative component. So, what does this mean? This means that helping people recover, regain independence after illness or injury through services like physiotherapy, counseling, and support groups come under post care rehabilitative. Then, the sixth component is supportive services like nutrition and balanced diet, safe water and sanitation, maternal and child health, family planning and immunization, and treatment of common diseases and essential drugs. So, these are the six components of comprehensive healthcare that you need to memorize. Now we have primary healthcare and universal health coverage. What are these? So, primary, it is the first point of contact that a person has with the health system. For example, you're sick and you live in a city. You have many options. You have the option of visiting a health and wellness center under the Ayushmann Bharat scheme. You have the option of a family doctor. You have the option of nursing homes or any kind of health system. So, whenever you are sick, the first health system that you approach, or the health service that you approach for, it's called the primary health care. It is the first point of contact that a person has with the health system. You need to emphasize or focus on the term first point of contact. It's very important for you to emphasize on this, because that will help you write the answer. So, primary health care is the first point of contact that people have with the health system. That health system can be your local clinic, your family doctor, or any kind of hospital, or any kind of health service that you take. Okay, then what's universal health coverage? So universal health coverage means that everyone can have access to health services they need, when they need them, and without falling into financial hardships. This is very easy, you can relate. Now just I want you to find the linkage between primary healthcare and universal health coverage. So when just think, if you are living in a city, you have many options. You have many options. You can go to a nursing home. You can, visit a family doctor. You can go to the medical college and hospitals. Options that you can take. So whenever a primary healthcare is strong, that serves as a foundation of universal health coverage, because universal health coverage, actually what does that mean? It means that whenever somebody is sick, then they are able to get the treatment. So whenever you have many options, you have many options. Like in a city, if there are limited number of doctors, then the competition between them is very low. So they may charge higher than the usual. But then when there are many doctors in a city, then what will happen? Quality of care that they give will be better, and due to this competitiveness, what will happen? That the fees will not be very much as compared to in a setting that has limited resources of healthcare. So it is very important to remember that when primary care is strong, it serves as the foundation of universal health coverage. This is very important because whenever you are writing an exam on comprehensive healthcare, so these terms are very important. Primary healthcare is something that government is emphasizing on much more than before, because before people had that mentality of going to the doctor whenever they would get sick. There was very limited options of preventive and promotive healthcare. But now, since government is realizing that preventive and promotive healthcare services are much important than the curative ones, because whenever you already have some health problem and you go for treatment, that is more costly as compared to preventing and promoting them at the first place. So the government is emphasizing on primordial prevention very much now, and public health plays a very good role in spreading the health and awareness things in the community. Like I have been in internships very much, and I have seen that how health education is transforming, because in a country where you have such a huge population and the people are not very aware or not very educated, so it's very important to start from grassroots, because people don't know anything. There are many people who do not know what anganwadi anganwadi is, how it is helpful, what are the services that it gives. And there is very I would say very irregularity in the amount of awareness that is present in our country. So at present, government is working much more on primary healthcare, and whenever the primary healthcare is strong, then it serves as a foundation for universal health coverage, and it is very effective. So you need to remember this very well. So we move forward to the levels of healthcare. I know most of us might be knowing this, but then I'll just revise it once. So the levels of healthcare in India is primarily divided into three sections. The most grassroots level or the broader level is the primary level care. Then we have the secondary level care, and on the top of the hierarchy we have the tertiary level care. Now, what all comes under these? So, in primary level of care, we have the sub centers, then we have primary health centers. In the secondary, we have the community health center or the CHCs, the sub-district hospitals or the first referral units, and the district hospitals. And in the top, that is tertiary level care, we have the medical colleges, specialized hospitals, apex institutions like AIMS. So, what are these basically? So why have I shown here the diagram? Why it is shown as a pyramid and not like normally written? So it is because I need you to understand that the you can see that the base is much broader. Okay, so just relate it with the diagram, the topic with the diagram. So you can see the base is quite broader, and the base has primary level of care. That means that most of the conditions that are not very critical or that does not require much attention, much healthcare attention, is solved in this primary level care only. That's why it is broader. Okay, then moving up, we have the secondary level care. In that, you can see community health centers, sub district hospitals, and district hospitals. So, these are the hospitals or these are the healthcare institutions that have better facilities than the primary level care, but then they cater to problems that are not solved from the primary level care. Okay, that is the reason they are, narrower as compared to the primary level care portion. Okay, so and then on the top of the hierarchy we have tertiary level care, where we have the medical colleges, specialized hospitals, and aims. So just I just confirm me that you are having cough. Okay, so you are having cough or influenza. I'll tell you influenza. So, will you go to AIMS directly, or will you go to the primary health center, or any kind of district hospital first? Uh, just tell me this. Obviously, we'll just move to basic forms of healthcare institutions, and then if the things will be complicated, then we'll move to the tertiary level care. So it's very important for you to understand that primary level care is equally important as compared to tertiary level care, because primary level care, it reduces the burden that the secondary level of care and tertiary level of care will had to encounter in case the primary level is not working. Okay, so primary level of care is equally important. It's not like if it has uh, it has lower quality of healthcare services, so it is not important. No, it is equally important, because it reduces the burden on the top hierarchy levels. Okay, so you need to remember this, what all comes in primary level care, what in secondary, and what in tertiary. And then you need to describe that why am I showing it with that pyramid diagram. You need to write it in the examination, and I bet you that your exam, your paper will look very beautiful if you explain this, because it's very important for you to make sure you need to be very clear in your concept. And then if we are writing this, the professor will obviously be very happy that, and they will be assured that no, this child knows this topic well. So it's very important for you to remember that sub centers and primary health center come under the primary level care, community health center, sub district hospitals, and district hospital come under secondary level care, and then medical colleges, specialized hospitals, and apex institutions like AIMS, they come under tertiary level. Now we have the Ayushman Bharat program. Okay, so it's very important as a public health professional to know what is Ayushman Bharat program and what all it covers. So Ayushman Bharat program was launched in 2018 by the NDA government, and it's India's flagship health initiative under the National Health Policy 2017. Has major two components. The first component is the Health and Wellness Center, and the second component is the Pradhan Mantri Jan Arogya Yojana (PMJ). So, what are health and wellness centers? So, initially we had sub centers and primary health centers, but then the government realized that why not collaborate these and make it one? Okay, so they actually transformed sub centers and primary health centers into health and wellness centers. And in these centers, there are many kind of services that are provided, like maternal and child health, communicable diseases, non-communicable diseases, mental health services, elderly and palliative care, dental, ophthalmic care, basic emergency services. So there are many services that are provided in these health and wellness centers. And I tell you, this is one of the success stories under the Ayushman Bharat program, and it's very effective too. and the government is trying to make it better day by day. So it's working well at most of the places. And then we have the Pradhan Mantri Jan Arogya Yojana. This is the second component under the Ayushman Bharat program. So what is it? It provides financial protection against hospitalization cost. Like it covers around 40% of India's population. Just imagine 40% of a country's population that has the highest number of people. So it is really a very big scheme. It incorporates more than 50 crore people. And what is the main feature of this Pradhan Mantri Jan Arogya Yojana? So it gives approximately or gives up to rupees 5 lakh per family per year for the secondary and tertiary care. So it is a flagship program and it is very effective, and it is a scheme that is talked all over the world, and India is somehow recognized by this scheme. So it is very very effective and it is very popular, and you must know what are these. So just remember, Ayushman Bharat program was started in 2018, and it is a flagship health initiative under the national health policy. It has two components. The first component is Health and Wellness Center, and the second component is Pradhan Mantri Jan Arogya Yojana. Okay. So, harnesses digital technologies and telemedicines as well. So, you need to remember this. And how is it related to comprehensive healthcare? So, comprehensive healthcare, we know that it works on the primary, on the physical, mental, social, and emotional, all the aspects. So, somehow, the Ayushman Bharat program also emphasizes on all the dimensions of health. So this is how in the answer, when you are writing about comprehensive healthcare, you need to incorporate like evidences. In the evidences section or the example section, you can very well quote Ayushman Bharat, because it is also working towards gaining the comprehensive healthcare in India itself. So it's very important for you to know this. Now, the challenges and barriers. So, of course, implementing comprehensive healthcare is not without challenges, because there are many kinds of challenges. Uh, I have divided these challenges into three subsections. So, in case you are writing an exam, so it pops, these flashcards pop directly. So, it's very important for you to know the challenges. First of all, there is limited funding, and the resources are very limited for everyone, because India is highly populated and the services are not very efficiently managed. Actually, there is a lot of corruption, so the services are not very accessible, and also there is limited funding. The government is not spending much that it should be spending on healthcare as well. So there is limited funding and the resources are also limited. Then we have unequal access, like rural and remote areas often lag behind, because their good services are not reaching to people. So there is unequal access. Then we have shortages of trained health professionals, especially in underserved regions. And also, very important, we have very weak infrastructure. Okay, the clinics, in many villages, you see health and wellness center is just not working. There are, you cannot find the basic things there, like clean drinking water, no electricity, no, good equipment. So the infrastructure is quite weak at some places. So these are the basic challenges. But then talking about these flashcards, I have divided it more in a better way, so that it retains in your mind. So first of all, the clinical and disease challenges. So the first challenge is chronic diseases and multimorbidity. What does this mean? So chronic diseases are the diseases that take a longer duration of time to get cured, like the non-communicable diseases. So in case you're suffering from chronic disease, you need to visit the doctor for a longer duration of time, be it lifetime too. So catering to these such a large population with chronic diseases is really challenging for the health system in India. But then We need to know that India is growing at a faster level, higher level, very high level, in the sense that non-communicable diseases are increasing too much due to our lifestyle. Then we have multimorbidity. What does this mean? So multimorbidity actually refers that, for example, if a person is suffering from diabetes, it's not that he'll just suffer from diabetes. He will have a lot of comorbidities attached. Like he may have some eye problem. He may have some nerve sensitivity issues. So and hypertension and all. So multimorbidity is present in India very much in all parts of the country. Most of the people you find that most of the people are not suffering from one disease but a multiple of diseases. Okay, so that adds up to the burden to the healthcare. And then we have epidemics and pandemics. We have seen how COVID actually revealed the true face of public health in India, and there were too many loopholes. So epidemics and pandemics, you can write very well how it affects, and how it is a challenge on the healthcare system. Antimicrobial resistance, what does this mean? So, antimicrobial resistance is basically the resistance that the microbes develop due to, uh, people taking different kinds of medicines. Just tell you the example of tuberculosis. Like initially, tuberculosis was we had some conventional medicines that were very effective. But then the microbes, the tuberculi, Mycobacterium tuberculi, that developed a resistance against those drugs. So what happened? Then after some time, it was seen that these conventional drugs are not working on Mycobacterium tuberculi. The scientists, they discovered some other medicines. So what happened? They gave another kind of medicines, and then they saw for some time it was effective, and again the microbes, they developed resistance against those, the second line of drugs also. Mm, we had, we are facing these challenges every time. So it is like the microbes know that, this drug, oh, I'm used to it now, I'm used to it now, I won't die with this. So what will happen, that it has created a lot of burden, because in a country where research is not very prioritized, so it becomes tough for the healthcare professionals or the healthcare scientists to work on that, because government is not giving much emphasis on research as of now. So antimicrobial resistance, it is said that antimicrobial resistance is one of the deadliest pandemic that is going to happen in the near future. So, after that, we come to the social and environmental challenges. So, what can be these challenges? Like climatic change and pollution. You can very well write how climatic change and pollution can add up to challenging the healthcare system. Like, in case of pollution, there are many kinds of diseases. Like, for example, in Delhi, you see the air pollution is so high, the air quality is so poor that many people are suffering from different kinds of lung diseases, COPD, asthma, bronchitis. It's increasing day by day. So this adds up like a burden to the healthcare system, and it is quite challenging for the healthcare system to manage these. Then we have climate change. Climate change is also very important, because in case of drastic climate change, there can be disasters, and that disasters, might add up, suddenly to the healthcare system, and it might be challenging to face them. So climate change and pollution. Then we have unsafe water and poor sanitation for, a large population, like those people who you see, they live in slums, or they live, in the bank side of roads. What happened that they do not have good access to water and sanitation. So that adds up to, diseases like cholera, typhoid, dengue. So all these things actually cause a burden on the healthcare system. Then malnutrition and poverty, it's also very common in India. It is seen that people are not very aware about malnutrition and poverty. Like, people, if you earn well, you have lots of option to explore in food. But then if you have limited resources, you do not have that much money, you know focusing on hunger is what people do. So it adds up to malnutrition and poverty, like people, like especially like students and the kids, they are pushed into malnutrition, and that causes a lot of problems like kwashiorkor, marasmus, many kinds of vitamin deficiencies. So these add up like a burden to the healthcare system as well. Then we have systemic and financial challenges like inequity and access gaps. Many of people are not having equal access to healthcare services. They might be living in some rural or remote areas, or they might not be having resources, not good transportation to reach the healthcare institutions. So these add up to the challenges as well. Then we have health literacy and misinformation. I tell you this, according to me, this is one of the most important challenges uh, as encountered, because health literacy is so poor in our country. And especially I've seen that in recent years, WhatsApp and social media, it is spreading good information as well as bad information equally. And this bad information is consumed by everybody, be it the kids or the elderly or the adults. Information is spread, that is spread whole, it is spread rapidly, and that adds up to misinformation, and people are doing different kind of odd things, unscientific things, that actually add up to a challenge to the healthcare system. Health literacy is very poor. Many people, like some basic things, like many people believe that pneumonia is caused due to uh, cold weather. No, it's never like that. There are many myths and facts that I'm going to include in on this channel as well. The common myths and facts, I'll burst these myths. So health literacy is very poor in our country, and misinformation is also spread quite rapidly. So it adds up to challenging the healthcare system. And then we have workforce and resource shortages, like there are limited healthcare professionals, limited funding. So these add up to being the challenge to the healthcare system. Talked about the negativity, like the challenges and barriers. So let's focus on the positive side also. So what can be the solutions and innovations? This is very important for you to write in your exam, because whenever you are writing challenges, just make sure that you are also giving good feedback, because as a public health specialist, it's not just talking about the challenges, but you need to develop solutions and innovations that are practical and that will add up value to your profession as well. So it's very important for you to include solutions and innovations as well. So the good news is there are many creative solutions that are emerging worldwide that can be incorporated in our public health work also, and that will improve the healthcare system as in whole. Like the mnemonic is heal die. You need to memorize it, and then you'll be able to write your answers properly. So H is health education and literacy. Since I have already discussed that there is a lot of misinformation and health illiteracy in our country, so health education and literacy is very important. And how this can be done? It can be done by public awareness, that we public health professionals are very well aware of. It can be done through health awareness, health education, promoting ads, and the government also working towards it. So health education and literacy is very important. We have equity and financial protection. Why it is important? Because if a person will be financially secure, like the Ayushman Bharat, it somehow secures the families financially in cases of health issues. So now more and more people are moving towards health services. Before, it was like, I cannot afford two meals a day. How will I afford healthcare services? So that was the mentality. But now with Ayushman Bharat and other schemes that are working in the government sector, the people are, becoming more aware, and they are actually availing the health services better. So it is very important to, especially for the government, to focus on equity and financial protection. And in these you can write examples like Ayushman Bharat PMJ scheme. Okay. Accessible and integrated services, it is also very important that these services should be integrated. Like in hospitals, you need to have multiple kinds of doctors, that if a person visits there, he'll be having all the access to all kinds of doctors, so that will save his time, his money, his transportation cost, and also his burden, his mental burden. So it is very important to have accessible and integrated services. Then leveraging digital technology. Digital health is, digital mission. It is one of the mission that Prime Minister Modi is working a lot on. He is actually focusing a lot on digital things, be it in any sector, and especially in healthcare sector. He has focused much more on it. So leveraging digital technology is very important, because paperwork requires a lot of time. It also requires resources, like, you need to have that storerooms where you need to keep all the files of the patient. So that was something that was very hectic. And also in at the individual level also, before the digital things happened. So it, whenever you need to visit a doctor, you needed to carry all the stuff, whatever your past history or past files were. So it was very hectic for the patient as well as the healthcare services, healthcare service centers. So the government is working more on leveraging digital technology, because it is more convenient, and it also saves a lot of time and funds. Then training and workforce empowerment. There are lots of things going on every time. We health professionals are going through continuous medical education, and there are many kinds of workshops or webinars, seminars, conferences. So these trainings actually improve the quality of care that the healthcare professional provides. So it's very important to go for trainings and workforce empowerment. Then holistic and person-centered care. It is also very important, because when a person is at the focus point of care, then it is more likely that he will have the decisions of his health in his own hand, and that will add up to him feeling that I am being understood, I am being valued, and it will add up to the prognosis well. Okay, so now then the last thing, the youth and community engagement it is very important, because youth is known as the backbone of any nation, or and in fact in India is known as the country of youth. So it is very important for the youth to know, because youth are the connecting link between the children and the elderly. So it is very important for the youth to be active, to be engaged in communities, in spreading good news and positive news, and also negative sometimes, because that also adds up to the values. It's very important that the youth and community engagement is being focused. Then other innovations can be integrated multi-sectoral collaboration, like nutrition, sanitation, and environment. These things can be worked all in all in a collaborative way, such that nutrition, sanitation, environment, all three are taken care of, at the same time. Telemedicine platforms for rural outreach, it is very much in effect now, because especially after COVID, people are focusing on digital health, and also people from rural areas also, they are aware about what is telemedicine, and they are becoming more aware due to digital things. And social media also is very good at spreading these news. And then we have mental health integration and palliative services. It is very important, because mental health was something that was ignored for a long time. Now, also in most of the countries, it is, especially in developing countries with lots of taboos and beliefs like India, mental health is something that is ignored. But then the government is also focusing a lot on it. There are many schemes, many programs that are working on mental health. And when mental health is being focused, so that adds up to the value to a person's quality of life. So mental health integration and palliative services are very important equally. So these innovations, when adapted to local needs, they can make comprehensive healthcare more practical and sustainable. Okay, so now to the conclusion. So, what is the takeaway? So, comprehensive healthcare is not just a health policy term, it is a way of building healthier, more resilient societies. It requires commitment from government, health professionals, communities, and also from the individuals. As individuals, we can learn about our own health, we can share knowledge with others, we can support community health initiatives, and advocate for policies that make care more equitable and access. So, together, small steps by the on the individual front, community front, healthcare professional front, these will add up, much more. And these steps, small steps from many people, can lead to big changes in public health. So it's very important for you to know what is the gist of the topic. At the end, we have some practice questions, and I want you guys to just comment the answers, the correct answer in the comment section, and whichever comment will have the answers correct, I'll just pin them. And also, I want you guys to provide feedback so that I would like to improve further, because this is very new to me. So I want positive as well as negative feedback from you guys, so that I'll just focus on what is what all I am lacking, and then subsequently we'll try to improve. And any kind of feedback, be it positive or negative, are welcome. And thank you so much for listening, and stay tuned, subscribe, like, and share. And if you like the video, then just give a comment, appreciation post, or anything, and that would be very valued. Thank you so much.